on our internet. Sometimes it goes and comes. Um,
That is okay, and
Probably
I am
next
here.
time we're trying to maintain social distancing and reduce our risk in this COVID-19 time. That's why we're not here in studio. But probably, hopefully, next time we can do it in person so we don't have this issue. Um,
That is totally fine. If you would like me to repeat
Yeah,
to
yeah,
some
go ahead
pertinent.
because I'm sure this is very important because a lot of people don't know that this is something that their children can use with and mix it with alcohol to get a high. And there are other, you can even touch on other drugs, over the counter drugs that youths are tapping into now because I think it would be very important and very useful for parents to know what their youth, what their children can be exposed to when they pick up these medication easily.
All right, sure, Rihanna. I'm here, and I don't mind going over just some pertinent details.
Yeah, just a
What I
quick
was
quick
is
bit.
that with the tuss drill, they cough lintus that do contain the codeine lintus in it. We have Tusco set lintus, and there's also the just pure codeine lintus. All of these medications do contain the codeine phosphate, and traditionally, or what it's supposed to be used for, at least when it's in this kind of dosage form, is an antitussive or a cough suppressant, something that just reduces the coughing. And it tends to be really effective because it gets into the blood circulation very quickly,
Mm.
and it operates quite effectively. Now, there are side effects to the codeine phosphate, which tends to be the addictive. Well, it's not really a side effect, but it is more of a point that we should note, which is the addictive nature of the codeine phosphate. So what I was saying is that quite a few youths have now been using it or have started using these medications or medications containing the codeine phosphate as a recreational drug, where they would put it in their alcohol, mix it with alcohol and Sprite, and they would
Mm.
use it as a chase, and they would use those chase and with it. And what tends to happen is that they do feel great and lively and euphoric for a moment, but overuse of this medication can have dire consequences as it relates to their health,
Mm.
and also them being addicted at an early age to a medication, or them being dependent on a medication to feel well, when it really should be that medications are to be used for a specific time
Mhm.
for a specific reason, and then you come off of that medication at the end of the time that it was specified for.
Mhm.
So those are the antibiotics that I was speaking about. Would you like me to touch on that, or
No, 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 no.
did we get
I just
did
wanted
that?
to just for you to just briefly touch on some of the other drugs that youths can use or are accessible to them that they can get over the counter and they are using it to get a high because parents need to know that these when they
Well, the
see them with
testosterone
it.
is well, the codeine is one of the ones that I do see predominantly being used. Something else that I do see that is being used constantly is just NyQuil liquid,
Mm.
and it has the opposite effect of the codeine. The NyQuil liquid tend to give you that sleepy or drowsy feeling. Now, what is important about, or what is important to note with NyQuil liquid or NyQuil capsules or tablets, because they have it in tablet forms as well, is that it does have this drowsy or creates a drowsy feeling or a sleepy feeling. And for patients who do have like sleep apnea or difficulty sleeping, they tend to use the NyQuil capsules, tablets, or liquid to aid them to sleep. But again, NyQuil is not for that use. My NyQuil is a medication or a brand with a medication or medications for cough, cold, and flu-like
Mm.
symptoms. So what you're
Yes.
also injecting in your body outside of the the sleep agent you're also injecting a antitussive, which is a cough suppressant. You're going to be ingesting painkillers, because most of the NyQuil capsule have acetaminophen in it, painkillers. So outside of really dealing with your sleep apnea or difficulty sleeping, you're also ingesting medications that really shouldn't be there. Of course, there are alternative sleep aids that you can find on the counter that are as effective or can aid in helping you to get rest. So I am seeing some young persons also coming in, or even older persons coming in for like the same NyQuil liquid or the capsule form, and then you're asking them, do you have a cold or so forth? No, I just use it to help me to sleep. So what I would tend to do is there are other natural dosage forms that can be used, and there are other medications that can be used specifically for sleeping that does not contain any other added medication. So those are the two main ones that I can tell you of right now.
And we are warned a lot when we go to the doctor that when we use medication, we shouldn't use alcohol, we shouldn't smoke, especially when we have a certain type of medication to use. But there are also medications that we cannot use, medicines that we cannot use or mix together. We can't use simultaneously. Can you speak a bit about that and the danger of mixing medications?
Okay. Yes, Rihanna. All right. So if we're going to look at the over-the-counter medications or over-the-counter drugs, the same codeine should not be used or mixed with alcohol, because, again, it creates the same euphoric feeling that can become addictive. And then on the flip side, the same NyQuil that I was just talking about should not be used with alcohol, because one, NyQuil is the agent in it which creates or causes you to feel sleepy. When you use it with alcohol, which is another depressant, that can further create a sluggish, lethargic feeling. Now, let's say you use, the NyQuil, you just come off of work around 4 and you have the flu-like symptoms, and you pop or you drink a NyQuil. And then at the same time, you go in and you head it out and you use alcohol with it. What you would have done is push your system into even more of a sleepy or a drowsy feeling than would have been if you had only used the NyQuil. So adding medication or adding alcohol to those two over the counter, and there are other medications on the counter, over the counter, that the alcohol does tend to create this depressed or really lethargic feeling.
But most people, not interrupting you, but a lot of people know that you can't use alcohol when you're drinking tablets. But there are some people that think, okay, I can drink a painkiller and I can use a certain other drug. I was asking if there's any risk involved when you mix certain medications together.
Yeah, there are risks. There certainly are risks. In terms of painkillers, the general painkillers on the counter with paracetamol, ibuprofen, or paracetamol, ibuprofen containing medications, they don't tend to react adversely to alcohol. But what tends to happen is that the alcohol tends to slow down the rate of reaction. So instead of, let's say, you use an ibuprofen and it works quickly, your alcohol, because of how it may disrupt the breakdown of the medication, can slow the way in which that medication works in your body. And then we can look at the flip side if you're looking at more prescription medications, where, let's say, we are using certain antibiotics. You can have really adverse reactions with these antibiotics, because some tend to create feeling of increased heart rate. Some tend to create feeling of you want to vomit. You want to, it may create a diarrhea like feeling, or bloating, and stuff like that when you use it with the alcohol. So as it relates to the over-the-counter medications, once you're using more suppressants or depressants, they tend to have that drowsy, sleepy feeling. But when you go towards more of the prescription medication, the really serious medication, the adverse effects of that is even more that can be felt by that patient.
In terms of supplements and vitamins, people tend to believe, oh, you can't get enough of that. Can we overdose on those things?
Okay. And that I think the only thing that you can overdose on in reality is fruits, vegetables. That's the only thing that you really can. But as related to medications that have been formulated by man, all of the medications that we have on the counter, and you just look through the list of ingredients, they have specific dosages. So these specific dosages are not there just for advertisement. It's to show you what these medications contain. Now, if you check on the internet, as really so quick Google search, you will see that, let's say, a vitamin B containing syrup, let's say Nutrifos. All right, they all have specific amounts of vitamin B's in it. That is not to say that you should be taking this how much ever you want, even though it's a multivitamin and it should be beneficial to you, because there is an overdose of B vitamins that can have adverse effects on your body. But what tends to happen with persons who might have mistakenly used more than what they should with these vitamins, what tends to happen is that the body just converts what it needs to convert and uses it for its purpose, and then the rest goes as waste and comes out in your stool or in perspiration or in urine. So you don't tend to really have that much of an adverse effect if it's like a 1 or 2 times something. But when this is a consistent, using the vitamins 5-6 times a day or a higher dose at each time than is prescribed on the bottle, then we have a problem.
We're coming down to the end of our program. The time flew by so quickly. I'm going to have to fast forward to some of the things that I wanted you to touch on. We're in the pandemic. We're in the midst of COVID-19, and I have to ask all my guests about this because we can't do a program without touching on it. It's topical, and nobody is getting away from it. So, as a pharmacist and knowing about how medicines are made and so on, how important and what role do you play in this whole scheme of things? And in terms of taking care of ourselves, what are some of the things that we can use besides taking our vaccine and practicing social distancing and wearing the mask? What are some of the other things that we can use?
Okay, great question, Rihanna. And again, the question is a twofold. So I'm going to deal with it first as it relates to the role of the pharmacist. As I would have stated earlier, the pharmacists are a part of the frontline team. And since the COVID-19 pandemic has started, the pharmacist has not stopped working. We have been the first point of contact as it relates to persons coming, oh, I have this flu-like feeling, I am getting a pain in my throat, and, they're telling of the symptoms. And so as it relates to the counseling aspect of things, pharmacists is definitely being upfront and, there for our customers who are fearful. And then some of these customers, what I would have realized over the couple of months is that many of them, because of the fear that has been circulating around COVID, they tend to come to the pharmacies to get treatments that they would have heard online or they would have seen on social media or so forth. Oh, this is effective. Let me just come to the pharmacy and buy some. But what I would have realized is once you properly counsel your customers, and once you would have properly explained to them the signs, the symptoms of the COVID-19 and how they should operate if they find themselves or they suspect that they have it, as it relates to isolating themselves from their family into a specific room, calling the hotline that has been given by the Ministry of Public Health so that a health professional can come, or they going to the health professional and or they're going to the hospital to get a test of it. So pharmacist has definitely been a solid part of counseling, a solid part of treating persons who do come with the flu-like symptoms that isn't really related to COVID, but persons are still fearful. And as it relates to this giving out the information that is necessary for the public to know. So I have discussion about COVID almost every single day as a medical professional. So at this point in time, there is a whole lot of information circulated. Our last continuing education program that we had as pharmacists, we would have discussed again COVID, our role as pharmacists in the fight against COVID, and also us encouraging our patients or customers to adhere to the social distancing guideline, adhere to the sanitization guidelines, and all of that. So pharmacists has definitely played and has been foot to foot with every professional, every health professional in the fight against COVID. And it is definitely an honor to be a part of a fraternity that is interested and working towards the health and productivity of our country. The next part of your
Question.
yes,
That was I was asking some of
your
the
next part of your
supplements and so on
question.
we can use to boost our immunity against COVID.
Pardon?
No, I was asking you
Oh,
some of the
great,
supplement.
great. Okay, so
Yes.
there are different brands on there are different brands on the market as it relates to immune boosting. So there's Vitabiotics brand. There is the emergency powder. I am seeing a Victory 60 powder that is being circulated as well, or will be circulated very soon on the market. So they are different vitamin C containing compounds, and that is what most of us as pharmacists are actually advising our patients to use, or our customers to use, which is boosting their immune system with the vitamin C. I have been reading the literature that they're stating that zinc supplements can be used as well, but of course at the right dose. And of course with zinc, there's a different dose as it relates to men versus women and children. So that you can go to your pharmacist and you can have that discussion. But some of these immune boosters or immune compounds, immune stimulating compounds, tend to already come with the zinc in it as an ingredient. So that is an added or extra benefit. So vitamin C, I'm definitely advocating for that. If you're not taking it as medication, you can use it in your fruits and your vegetables, fruits especially the cherries. I think that's one of the fruits that contain the highest level of vitamin C. There's the apples, there is the oranges and tangerines. All of those contains the vitamin C that is necessary to keep us boosted. Another important thing, three other important things. Exercise is important because not only putting in, but your body needs the exercise as it relates to boosting immune system. Another thing is hydration. Many Guyanese are walking around dehydrated, and they may
Yes,
think
it's
that
true.
it's not important as it relates to immune health, but it is super important because the body being at a specific temperature or being cooled works better than a body that is with a body that is or has an elevated temperature or has a fever. So it is important that we keep the body cool. Your coconut water is really great in Guyana, or just regular water. So that's also important. And the final thing is rest. We have been working and working and working and working over time. And yes, the COVID-19 pandemic has been or has taken over for last year. So a lot of persons are thinking, something this year here, I am going to go all out. But exhaustion and illness does not help your financial situation. So it is
Hello? She's gone. Miss Blair? Hmm. Okay. So, so we having some more technical difficulty, and because of that, we'll have to cut short our program. We just want to thank you for listening to us today on Kaieteur Radio. We're trying to encourage you to use your medication correctly, to take precaution to boost your immunity against COVID-19 in this time. And we are always advocating for you to get vaccinated because it's important that you protect yourself and your loved ones against the spread of this deadly disease. We see the numbers rising. We see we may not be able to completely stop the spread, but we can stop people from dying when we take the vaccine. So on behalf of the Kaieteur Radio team here at our studio, I'd just like to wish you a good afternoon and tell you to be safe and join us next Monday for more on your health matters. Goodbye.